Hello, everyone. I'm Benny DeCecca, Chief Executive Officer of Validation Institute, and today I am joined by Bran Newland, the CEO and co-founder of Goldfinch Health. Hi, Bran.
Hey, Benny. Thanks for having me.
Great to have you here. So at Validation Institute, we vet and validate the performance claims of healthcare companies, especially around savings and outcomes. We put companies through a rigorous process of understanding what the company does, their methodology for measuring outcomes and savings, and we look at the underlying data to make sure companies like Goldfinch are doing what they tell their customers they can come to enjoy about working with amazing, transparent companies like yours. I know one great part about working with Goldfinch is that optimizing the surgery experience combined with your Nurse Navigator program, you are able to get people back to work faster, saving companies money. Can you explain a little bit more about Goldfinch's offering and what inspires your work at Goldfinch?
Benny, thanks for the introduction. And I'd love to talk about what inspires our work and get a little bit into the details of how we do that. So, we're inspired by personal experience and by experiences of our family around surgery and the recovery after that. A couple of years ago, my mother went through a cancer diagnosis that led to a surgery, actually a series of surgeries. And while she's a 30-year RN, registered nurse, and comes from a family of nurses, I saw what it looks like when you're the patient. You're an expert going into what can be a scary time in your life, and the screen went blank. Even though she had provided help to others at trying times in their life journey and in their healthcare journey, she needed a navigator when she was the person in the center of that. I've also seen a grandfather go through surgery. Unfortunately, many of us have probably had this experience where somebody in your family goes through surgery and they're never quite the same. And that was his experience. My co-founder, John, unfortunately lost an uncle to a hospital-borne infection after a hip replacement. He also has a family member who's in long-term recovery from opioid addiction. So these are the things that inspire us on a day-to-day basis. Surgery is scary, and it can be done in an amazing fashion in the year 2022, heading into 2023. But a little assistance goes a long ways. And so what we do at Goldfinch Health, it's nurse navigation empowered by technology through what are called enhanced surgical pathways. These are clinically validated, evidence-supported pathways that have been around for 20 years that reduce the stress on the patient through the surgery, before, during, and after. When you can do that, the results can be miraculous in terms of recovery time, return to your normal life, return to work, your dependence on heavy-duty painkillers like opioids. All of those things can be greatly improved. The problem is it's just not as implemented as we wish it was. And that is really what we set out to try to change when we launched Goldfinch several years ago. So that's the work that we do. Really, we're in the business of helping companies save money on surgery without restricting provider choice.
Well, that's amazing. And, from personal experience rises great companies, and it sounds like you've done that there. And I kind of wanted to understand, when you pursued the validation, why was that important to you?
Well, we know that this is an area that perhaps you've never heard about, that you've never thought about the idea of a different way through pain management or a different way through surgery, and never heard about enhanced recovery after surgery, these enhanced surgical pathways. How would you, as the typical person going about your life? You're an expert in construction, or an expert in accounting, or an expert in sales, but not an expert in surgery. So how would you even know that this exists? And so as we're sinking our teeth into this and going out, we sell our program to self-insured employers and labor unions and managed care and insurance companies. They may have never heard of this or thought about it. And so having an expert third-party review, third-party stamp of approval, so to speak, from an entity like Validation Institute that's got a long developed reputation in the market, that's worth its weight in gold. And that has proven to be the case since we announced our validation just a few months ago.
And, moving forward with validation, how does the project fit into your strategy? And, do you see any other areas of validation coming from this validation and moving forward into other areas?
Certainly, yeah. The first Validation Institute project that we did together was around save days in recovery time, which Benny, you mentioned. So this was around how much sooner can we help someone get back to their life, back to work after a surgery. We compare the experience of a Goldfinch supported member with a national database with over 17 million claims. And what we found was almost 32 days saved per case. 32 days saved per case. So over a month, faster recovery time, a 770 to 1 ROI, $7.70 to 1 ROI. That was what was found in that first project. And so that's dramatic. That's compelling. The next phase for us, and sort of the next areas where we're developing, one is around total cost of care. That's on everybody's mind. How can you better manage total cost of care, avoid high cost claimants in your plan? And we have a story to tell there as well. Better surgery is lower cost. This is one of these areas in healthcare where better can also be lower cost. And so we're working towards a project on validating a reduction in total cost of care through our support of surgery and recovery. Another area that we're working on, this was just announced, we're working in a program in the state of Iowa, supported by Attorney General Tom Miller in the state of Iowa, to work with rural hospitals around opioid prevention. This is funded through the opioid lawsuit settlements. We are working with hospitals serving rural communities across the state of Iowa through what we call the Billion Pill Pledge to help rural hospitals reduce opioids dispensed and used after surgery by 50%. That's another outcome of the work that we're doing. All of these things are closely related, right? Fewer opioids means faster recovery, means lower cost of care. All of these things are related, but we're working specifically, supported again by these opioid settlement dollars from the lawsuits, to reduce opioids in these rural communities. That's going to set up very nicely as a future validation as well to show, hey, this does in the real world, not just in the clinical studies, that has been widely studied, but in the real world, greatly reduce the use of opioid painkillers after surgery and provide better patient experiences and better pain management at the same time.
Can I just ask, did you say 1 billion pills?
Yeah, great question. So why do we call it the Billion Pill Pledge? So the Billion Pill Pledge, that's the idea that through better implementation of these enhanced surgical pathways, more conscientious opioid prescribing practices around surgery, we can reduce by 1 billion pills in our country alone, those that are left over and available for diversion or use by the patient, him or herself, in a way that leads towards dependence. So there's actually 3 billion pills left over. Our goal is to reduce that by 1 billion.
Wow, that's amazing. And it's amazing work you're doing with the state of Iowa. So hopefully that translates into a lot more states.
Yeah, thanks, Patty.
Well, what's next for Goldfinch Health?
It's really how can we dig in on this state of Iowa program, demonstrating reduction in opioid use. One of the things that we're doing, we've also expanded by a bit our program, and I'll just show something here. So our program, Nurse Navigator, technology empowered, enhanced surgical pathways, but this is called the Prepared for Surgery Toolkit. So we're adding something tangible to the program. This arrives at the patient's house and includes a number of items that are helpful to an optimal surgery experience. Some pre-surgery nutrition support. One of the other items in that toolkit is what's called a Deterra opioid deactivation and disposal kit. And so what that does is if you've got leftover pills, so hopefully you're getting prescribed fewer because you'll need fewer, maybe not any at all, but even if you do need a few, that's fine. You have some left over. And what do you do with them? It's kind of a pain in the backside to figure out what to do with them. You know, you don't want them in your medicine cabinet. Try to keep track of your pharmacy take back day, or maybe your police station does a take back day. But what you can do with this deactivation kit, you put the leftover pills in there, you put some water, you shake it up, it's done. You can throw it away in your garbage. So makes that part easier as well. That's part of the overall strategy here. This is about first dose prevention around opioids and how do we get them out of your house as soon as possible. And so they're not there causing you any problems later or anybody around you any problems later as well.
That is amazing. So there's a lot of amazing things going on, and it's convenient for your customers and getting people back to work faster. So you've got a lot of great things going on there, and we're thankful to be working with you on getting the word out about it. So thank you very much for that. And I ask everybody that's listening to this to go to our website, validationinstitute.com, and read this validation. And again, thank you very much, Brian, for being here today, and I hope you have a great day.
Thanks, Benny.